Imagine going about your day when suddenly simple things like going to the bathroom become a challenge. Frequent trips at night, difficulty starting, or the nagging feeling that you haven't quite emptied your bladder. Sound familiar? These are the kinds of symptoms many men deal with but don't always talk about, and they often point to one thing: prostate issues. The truth is, prostate health becomes a concern for most men as they age. Yet it's something many don't pay attention to until it's too late. But what if I told you that small, easy changes to your lifestyle now could drastically reduce your chances of developing serious prostate problems later on? The good news is, with the right knowledge, prevention is within your control. From diet and exercise to understanding which symptoms to watch out for, taking action early can make all the difference. In this video, we are going to cover the essential tips for maintaining prostate health, whether you're trying to prevent issues or are already dealing with them. And don't worry, we'll also dive into the latest, most effective treatments available for prostate conditions, so you know exactly what steps to take if problems arise. Stick around because this information could improve your quality of life. What is the prostate? Let's start by understanding what the prostate is. The prostate is a small gland, about the size of a walnut, located just below the bladder in men. It wraps around part of the urethra, which is the tube that carries urine out of the body. The main job of the prostate is to produce seminal fluid, which helps transport sperm during ejaculation. Though it's small, this gland plays a significant role in reproductive health. As men age, the prostate tends to grow, and sometimes that growth can lead to problems. But don't worry, we're here to explain what you can do about it. Common prostate problems. There are three main types of prostate problems that we need to talk about: benign prostatic hyperplasia BPH, prostatitis, and prostate cancer. Number 1, benign prostatic hyperplasia BPH. Benign prostatic hyperplasia, or BPH, is the non-cancerous enlargement of the prostate. It's very common as men get older. More than half of men over 60 have some degree of BPH. The enlarged prostate can press against the urethra and cause urinary problems. Symptoms include frequent urination, difficulty starting urination, or the feeling that the bladder isn't fully empty. Number 2, prostatitis. Next is prostatitis, which is the inflammation of the prostate. This can be caused by a bacterial infection or other unknown factors. It can affect men of all ages, but it's most common in those under 50. Symptoms can range from pelvic pain, painful urination, to flu-like symptoms if the infection is severe. Number 3, prostate cancer. And finally, there's prostate cancer. It's one of the most common cancers in men. But the good news is that when detected early, it's highly treatable. Prostate cancer often grows slowly, and many men with the condition might not even need immediate treatment. But understanding the symptoms and getting regular screenings is key to staying on top of it. Causes of prostate issues. Now you might be wondering, why do these prostate issues occur? Number 1, age. The most significant factor is age. As men grow older, the risk of all three conditions increases. BPH and prostate cancer are particularly common in older men. Number 2, hormones. Hormonal changes also play a role. As men age, the balance of testosterone and estrogen can change, which may contribute to prostate enlargement. Number 3, genetics. Family history is another major factor. If you have a father or brother who has had prostate problems, your risk increases significantly. Number 4, lifestyle. Lifestyle factors like a high-fat diet and lack of exercise are also believed to play a role in prostate health. Obesity and diets high in processed foods can increase the risk of prostate issues, including cancer. Symptoms. Understanding the symptoms of prostate issues can help you seek help sooner. Here's what to watch out for. Number 1, urinary issues. If you find yourself waking up multiple times during the night to urinate, struggling to start or maintain a stream, or experiencing pain during urination, these could all be signs of BPH or prostatitis. Number 2, pelvic discomfort. Prostatitis often comes with pain or discomfort in the pelvic area, lower back, or even the genitals. Number 3, erectile dysfunction and blood in urine. These are less common symptoms but can indicate more serious prostate issues, including cancer. It's important to remember that some prostate conditions, particularly prostate cancer in its early stages, may not cause any symptoms at all. That's why routine checkups are so critical. Prevention tips for a healthy prostate. So, how can we keep our prostates healthy? The good news is that there are several lifestyle changes that can help reduce the risk of developing prostate problems. Number 1, diet. Let's start with diet. A balanced diet rich in fruits, vegetables, and healthy fats can do wonders. Foods like tomatoes, which contain lycopene, cruciferous vegetables like broccoli, and omega 3 fatty acids found in fish are known to support prostate health. Try to reduce your intake of red meat and processed foods, as these can increase inflammation in the body. Number 2, exercise. Exercise isn't just good for your waistline, it's great for your prostate too. Regular physical activity helps to maintain a healthy weight and reduce inflammation, both of which are key in lowering your risk of BPH and prostate cancer. Number 3, regular checkups, routine screenings are essential. The most common screening test for prostate issues is the PSA prostate specific antigen test, which measures the level of PSA in your blood. An elevated PSA level can be a sign of prostate problems, but it doesn't always mean cancer. Talk to your doctor about when you should start getting screened. Usually, this begins around age 50 or earlier if you have risk factors. Number 4, stay hydrated. Drinking enough water is crucial for urinary health. However, limiting fluids in the evening can help reduce nighttime trips to the bathroom. If you're dealing with BPH, avoid smoking and excessive alcohol. Smoking and heavy drinking can both increase the risk of prostate cancer. Quitting smoking and moderating alcohol intake can significantly improve your prostate health as well as your overall health. Treatments. If you're diagnosed with a prostate issue, don't panic. There are many effective treatments available. Some of them are listed below. Number 1, medications for BPH and prostatitis. For BPH, medications like alpha blockers can help relax the muscles of the prostate and bladder neck, making urination easier. Prostatitis might require antibiotics if it's caused by a bacterial infection. In some cases, anti inflammatory medications and lifestyle changes are also recommended. Number 2, surgical options. For severe BPH, surgery might be necessary to remove excess prostate tissue. One common procedure is called transurethral resection of the prostate tube, which helps to relieve symptoms by reducing the size of the prostate. Number 3, prostate cancer treatment. When it comes to prostate cancer, treatment varies depending on how advanced the cancer is. Options include active surveillance, watchful waiting, surgery, radiation therapy, hormone therapy, and even chemotherapy. Early stage prostate cancer is often managed effectively with localized treatment, while more advanced cases might need more aggressive approaches. Number 4, complementary approaches. Some men find relief from prostate symptoms through complementary treatments like acupuncture, herbal supplements, or stress reduction techniques. However, always consult your doctor before trying any alternative therapies as they can interact with conventional medications. If you would like to watch my other lectures on topics like the lungs, kidneys, liver, brain, and eyes, visit my channel to view my other videos.